your mouth.
All right, we are back. It's always good to have the HTV dental expert on, Dr. Ron Walker. He's been giving us some valuable information, so we have more today. Doc, good to see you.
Good to see you, Martin.
Doing okay?
Doing great.
All right, so we started talking about gum and bone disease, and God, it's just something that's so important, especially at a young age.
Yep.
But, when you start neglecting your teeth, give us some little background on that.
So last segment we talked about, plaque and brushing, right? So this is pretty much the progression of that. So this is what happens if you let that go for too long. The soft plaque is going to turn into more of a hard mineral substance called tartar, or we call it calculus. And this is what you hear about on commercials and stuff like that. So the tartar is a mineral deposit, and we're going to look at a picture of it right here and see what it looks like. This is what people build up above the gums every 6 months when you go in for your cleaning. This is what normal people start to build up, and then you can feel it. You can feel it when they clean it off your teeth. And it's not that much of a problem as long as you get cleanings every 6 months, but also it can build up underneath the gums, and that's going to lead to more severe gum and bone disease type situation.
I guess plaque is plaque no matter where it is in the body, right?
Yes, sir. Exactly. It can be, yep, exactly.
But it wreaks havoc wherever it is.
Yes, sir. Exactly.
All right. So, and what kind of problems does it cause, and what do you see from your experience?
So it can cause premature tooth loss. First, what it's going to do is going to cause irritation in the gums. And then that irritation or infection is going to cause an infection in the gums, and your body's going to try and fight that off. It's going to treat it as kind of a barnacle under the gums, right? So it's going to attack it and try and fight it off. And in the meantime, what's going to happen is you're going to start to get bone loss.
That's a great way to describe it. A barnacle. Boy, and then those are pretty sharp too.
Yes, sir.
They can
So
cut.
when you start to get that bone loss and gum recession, the bone is a foundation for the tooth. So over time, more and more bone loss, tooth's going to start to get loose, and you'll end up prematurely losing your teeth.
All right, let's bring up the next picture. What are we looking at now, Doc?
So we're looking at right here is on the left side of your screen is what a normal x-ray is going to look like, right? The blue line is going to represent where the gum's going to be, although in an x-ray you're not going to see that. And then the red line, what you see is that's the bone level. So on the right x-ray, you see the barnacles. I mean, that is it. It's below the gum, above the bone, and you're going to start to see here, you see a little bit of bone recession, less bone there than we would like to see. And, at this point, it's very treatable. You can come in, you're going to get a deep cleaning. You can treat that disease and be all right. But if you let it go too long, we're going to start to look at what happens if you don't treat it.
Ouch,
right?
we don't want to know that.
Yes.
So take care of the teeth, right?
Yes, exactly. So
right.
we'll look at next pick
All right.
and
Let's
see
bring
what
the next
happens
one
if
up,
you
Jay,
go
if we
too
can.
long. Right. So as you see on the left side of the screen in that x-ray, that's about, kind of where we would like to see the bone level. But as you go further back, you see that bone level drop. And that's when you're really starting to get a lot of bone loss. And just a bad deal. You don't want that to happen.
All right. Let's go to the next picture if we can, Jay.
So this is very severe. You can see on the right and left where the bone is, and in the middle you can't even see the bone, it's so far down. It's unfortunate because this is actually treatable, and the bone levels will not come back. Once they're gone and you lose bone from gum and bone disease, that's it. There's no magic thing I can do to bring the bone back. And it's
Is that when
gone.
they need to come out at that point?
Yep, you guessed it. At that point, when you get that much bone loss, the pocket depth between the gum and the tooth gets too severe where you really can't get in there and keep it clean. So the tooth is then going to become to get loose, and then comes out.
Yeah, you can only do so much to save it.
That's it.
It's up
That's
to
it.
the patient.
Yes, sir.
Yeah. Let's bring up the next one if we could, Jay, and we'll talk about this. Wow.
Yep. So that's pretty graphic, but that is what it looks like. That's under the gum. That is the barnacles that you see. And those can be treated. You can get that cleaned off of the teeth. You can get a deep cleaning. It doesn't have to get that bad. You just got to get your teeth clean.
How does the patient know they have this?
You really don't. It doesn't hurt. Unfortunately, that's why a lot of people let it go for so long, because this disease doesn't hurt. until it's too late. I mean, you can get some infections, but it doesn't hurt. It will cause bad breath though. It's a very distinct smell that if you ever smell it, that's what we call it periodontal disease or gum and bone disease smell like. It's not pleasant.
So if your significant other backs off by 5 feet, go to the dentist.
Exactly.
We'll see.
Send it to the dentist.
How do you treat it? How do you?
So deep cleanings. A normal cleaning, like a routine patient gets, is every 6 months. You come in, no need for any anesthesia or anything like that. Some people might need some nitrous to relax them, but that's just a normal cleaning, right? Things are above the gums. But for these patients, we're gonna have to get you numb because we gotta go below the gums, clean all this off, and then after that, we'll probably put you on a 3 to 4 month recall. Eventually, what we want you to do is get back to a 6 month recall like a normal patient, but some patients never make it there. After you do your deep cleaning with anesthesia, then we'll bring you back 3, 4 months, see how you're doing.
I guess it's like any other doctor of any other, specialty. You sort of increase and decrease as you see the progression.
Correct. Exactly.
All right, very good point. Doc, good to see you again.
Thank you so much.
All right, so I guess the goal and the role of the patient is don't get to this point.
Don't get to this point. We can help you. It doesn't have to get that bad.
Floss, clean, and then it'll be every 6 months to a year, right?
Yes, sir.
All right, Doc, good to see you again.
Thank you.
All right, there you have it. Dr. Ron Walker, our dental expert on HTV. We'll see you again next week.